This conference will now be recorded.
Good afternoon, everyone. Thanks for attending. I'm Melissa Morin, a Public Information Officer with the Whatcom County Health Department. Today we're going to hear from Health Department Director Erica Lautenbach and Health Information and Assessment Supervisor Amy Hockenberry. Before we begin, I just have a couple of reminders for everyone. This briefing is being recorded and will be available later this afternoon on the Whatcom County YouTube channel and at our media page at www.whatcomcounty.us/COVID. Also, please make sure to keep your microphone muted unless you've been called on to ask a question. We'll go ahead and turn on the chat feature at the end of our speaker's remarks, and at that time we'll invite members of the media to type your name and affiliation into the chat box if you'd like to ask a question. And with that, I'd like to introduce Erica.
Thanks, Melissa. Good afternoon, everyone. Most significantly, I think I'd like to just share with you that after careful consideration, the health department has decided to, and our health officer has decided to put out a health officer directive on wearing masks in public, both outdoor and indoor spaces. That just came out and it will take effect on Friday of this week. We do not take these decisions lightly. This is not a requirement, but it's a should rather than a shall. It does not have enforcement. We do not have enforcement capability, but it is a directive, a very strong recommendation for everyone to wear a mask when they're out in public spaces. We are not limiting these face coverings to just masks. As you may have seen, people wear bandanas, other types of face coverings. People can make face coverings, so this isn't intended to be overly burdensome. But I think our intention behind this is, there's a few reasons. First, as we are preparing for phase 2, and phase 2 may come in as soon as 2 weeks, we recognize that there will be more people out and about, that more businesses will be open, more people will be interacting with each other. And masks are over and over again, a proven strategy to help reduce the spread of COVID. Our intention in this is really to give us an additional tool for our community so we can reopen safely and we can ensure that whatever additional peaks we have, we can try to limit those by using all of the different tools that we know are effective. We do not have good treatment options. We do not have a vaccine, but we do have hygiene, we have distancing, we have masks, and we have testing and follow-up case and contact investigations. Those are the tools that we have available to us, and we want to make sure that we're using all of those tools as effectively and in a most widespread way as possible. We have also heard from business owners through the process of the Public Health Advisory Board's task force that it would be helpful for them if they could point to something that the Whatcom County Health Department is doing so they could, in a more effective way, ask for their customers to wear masks. We don't want, for some businesses who choose to do the right thing, them to be put at a competitive disadvantage because they ask customers to wear masks. And it's an important partnership, and we want to give our businesses and organizations the tools that they know will help keep themselves, their customers, and their staff safe. So there are a few reasons why this is the right time to do this. We recognize that masks can be uncomfortable, that it's starting to get warmer, but we know that they work. We know that they're very effective in protecting ourselves from other people. And I think the theme of we're in this together really extends to the mask wearing, where when we are out in public, we are protecting each other. We know that at least 20 to 25% of cases nationwide, the cases have been identified with no symptoms. So I may feel perfectly healthy walking around the streets, but I may be carrying that virus, and I may be able to spread that virus to others. And if I wear a mask, I can help prevent that spread. So we're really enlisting the help of all residents, of businesses, of organizations to make mask wearing something that we think of much in the same way that we have reusable bags. Keep a mask in your car, and whenever you get out of your car, put it on. When you leave your house, put it on. Don't forget, and hope to normalize this behavior so we can be more effective in fighting this COVID spread in our community, and we can help ensure that as phase 2 moves forward, we can have a phase 3 and a phase 4. So with that, I will also just briefly talk about the Public Health Advisory Board Task Force. We met last week with the task force members. There are about 140 members, and we've designated sector liaisons who will receive training early this week and will start to convene other members of their sector to work through guidance and recommendation and best practices that work for each unique sector, with the help of the Public Health Advisory Board, with the help of our Whatcom County Health Department subject matter experts, with the help of our Whatcom Unified Strategic Planning team, who's doing a lot of work right now to identify what guidance already exists and use that as a framework by which those sector meetings can use to build and to finalize that guidance. So that is moving forward. We're really encouraged by the number of businesses and organizations and faith community that are interested in this process. And we are also encouraged that by going through this process and by building buy-in, we will see higher rates of infection control and social distancing measures in our business and other organizations as they're able to open. One more item that I didn't mention is in terms of the masking directive. We are very committed as a community to making sure that that finding or procuring or buying a mask is not burdensome, especially to those who are most vulnerable. And the Whatcom Unified Executive Board met this morning, and we've asked Whatcom Unified to assess, with the help of community partners, what the need is among our vulnerable populations and come back with a recommendation for how we might be able to purchase or otherwise procure durable face coverings for vulnerable populations. We, as an executive board, also asked Whatcom Unified to find out costs and availability of procuring a large number of, we talked about 100,000, but it might not be exactly 100,000, to find out what the cost of a mass purchase would be, so we could help our businesses, our organizations, local governments, and others have single use or disposable masks available for customers and people who come into our various buildings. So we're looking at that as well. And I had a great conversation with the various chambers of commerce around the county, and they on Friday we had a great conversation, and they are all interested and enthusiastic about helping distribute those masks to members of their chambers, so we can get those into the hands of business owners once they open. So there's some good positive things that are coming from this, and we're looking forward to seeing greater use of masks and face coverings around Whatcom County. So with that, I'll turn it over to Amy.
Thanks, Erica. So I'm here today. I'm going to be providing an overview of the update on data on our website. You might have noticed we've added a new chart that shows the cumulative count of confirmed COVID-19 cases in Whatcom County since March 10th, when our first case was reported. This chart shows the number of confirmed cases that have been reported to us each day. Also on the chart along the bottom is a green line showing the number of new cases each day. So you might notice that that only 12 new cases are reported for the week of May 10th through the 16th on the chart labeled confirmed COVID-19 cases in Whatcom County by week, just above this one. But according to the cumulative cases, 18 cases were reported during the same week. So the chart above is an epidemiological curve, or an epi curve. This has been on our website for some time now, and which uses the date that a person's symptom has started, also known as the date of illness onset, as it's shown on the x-axis of the chart. The date of onset of illness is different from the date that we receive the test and report a new case. Some cases that were reported to us last week are among people whose symptoms actually started the week before. So those cases show up in the previous week, an epi curve. So that's a little bit to understand the differences between these two charts. We've also added a map that shows the number and the rate of confirmed COVID-19 cases for geographic regions within Whatcom County. When looking at data by sub-county location, we often use public school districts to define community boundaries because people tend to identify with their community in connection to schools and school districts. Some communities are using other geographic boundaries like zip codes or census tracts for reporting data by location. We choose not to use zip codes or census tracts. First, zip codes cut through cities and towns, so they don't align well with the way many of us identify where we live. And right now, if we were to use census tract in our data analysis, we couldn't share a lot of the data publicly. And that's because we have to follow small number guidelines that protect the privacy and confidentiality of protected health information, which also helps us share reliable and accurate data. Our COVID-19 case map includes both rates, the number of cases per 100,000 residents, and the total number of cases. We prefer to use rates when we're comparing against geographies, across geographies, because they factor in different population sizes and demographics so that we can compare different populations. So using a rate helps us assess the differences using a fair comparison. For example, a case count of 30 people is very different in a community of 1,000 residents than it is in a community of 50,000. Areas with lower rates or fewer confirmed cases should not be interpreted to be safer than any other areas. Where someone lives does not necessarily represent the place where they got COVID or where they traveled while they were infectious, or if they traveled at all. And the limited amount of testing that was available early on in the outbreak may also mean that current rates and counts are not a good representation of the actual spread of COVID-19 throughout Whatcom County. What the map does show us is that the virus is present everywhere in our county, and we all should take precautions to protect ourselves and prevent spreading it to others, no matter where we live or work, and using our masks or face coverings. And then the last one I want to share with you is also added a new chart reporting confirmed cases by race and ethnicity. Was at the very bottom. To provide an accurate and meaningful analysis, a minimum of 80% of data about COVID-19 cases must have race and ethnicity reported. And just last week, we reached this threshold. Currently, most COVID-19 confirmed cases are reported through laboratory systems that don't have and are not required to get information on a patient's race and ethnicity. So we've started to proactively collect this information more thoroughly in our disease investigations. Additionally, the Washington State Board of Health is currently reviewing the reporting requirements for all notifiable conditions, which are conditions that labs and healthcare providers are legally required to report to public health officials. So this might give us an opportunity to require reporting of race and ethnicity data statewide for COVID-19 in the future. Although there's much to learn about COVID-19, currently in Whatcom County, data shows a disproportionate impact for some populations. For instance, people of Hispanic ethnicity and for American Indian and Alaska Native people. National and state data also show that people of color are more negatively impacted by the effects of COVID-19, physically, socially, and economically. Our 2018 community health assessment found that many factors contribute to higher health risks and poorer health outcomes in specific populations. These factors include living and working conditions, income and wealth, underlying health conditions, and access to quality health care. The COVID-19 outbreak has magnified long-standing inequities and provides an urgent opportunity to address them. As for our new data on our website, we'll be updating race and ethnicity and cumulative case counts weekly. Now I'll pass that to Melissa.
Great, thank you, Amy and Erica. We're going to go ahead and turn on the chat feature here. So any members of the media who would like to ask a question of our presenters, please go ahead and enter your name and affiliation in the chat, and we will call on you to ask your question. Looks like we have a question from Key Relia with the Herald. Key, please go ahead.
Hi, thank you. This is a question for Erica. Erica, can you clarify the mask, the cloth covering requirement just issued by Dr. Greg Stern? Is it, you said it's a more of a you really should rather than a you must? Can you parse that a little bit more for me just so I'm clear? This obviously is let's do our part to prevent the spread of the transmission, but how seriously should I take this as a member of the public? Thank you.
Yeah. So this is a should rather than a shall. We will not be issuing tickets. We will not be citing people who aren't wearing a mask. And we also ask that the public not call 911 or call the health department with complaints about people not wearing masks. There are reasons why certain people wouldn't be wearing masks. For example, people who are deaf or hard of hearing or individuals that they may not be able to easily take off a mask or put on a mask, or have respiratory issues that would prevent them from being able to. So I guess we just ask that people have grace with others and not shame people who aren't wearing masks. But most importantly, that if you can, you absolutely should wear a mask when you're out in public. So it's not a shall, it's a should.
I don't yet see any other questions in the chat feature. So if there are any other questions, please go ahead and type your name into the chat. Looks like Key has a follow-up question. Key, go ahead.
I feel like I have you all to myself. I'm very excited. Can you, another question I had, Erica or Amy, is we have had a huge surge in the number of tests that have come back negative, just showing in general, I would think that there are a lot more testings being done, but could you take the time to explain that? What is that signal to us?
Amy, do you want to answer this or do you want me to answer it? Go ahead.
I think part of an answer, which you might have the other half, Erica. From my understanding, we know that DOH had a significant backlog in our negative tests. So from my understanding, some of that has to do with that backlog of that showing up finally within our numbers.
Thanks, Amy. Our next question is from Pat Grubb with the Northern Light. Pat, go ahead. Pat, if you're with us, you can go ahead.
Yeah,
And
sorry, got the mute. Do you happen to know how many active cases there are right now in the county? And can you describe a little bit about your contact tracing of those cases?
I could, Amy, do you know the exact number of active?
No, and part of that, we're working on, we just got a working definition of what recovered means. And so there is definitely some work that is underway to distinguish now that we have an official definition of what recovered is. So we're working on that. So there isn't a number right now to provide you.
Okay, and the contact tracing, can you describe a little bit of your efforts in that regard?
Sure, I can tell you from a high level, and we could most definitely have one of our staff who does this day in and day out follow up as well about what it actually looks like on the ground and what they're doing. But we are at a standard where the same day that we receive a positive case, confirmation of a positive case, we're able to contact that individual. And within 48 hours of contacting that individual, we're able to make contact if we can find their contacts with, we're able to within 2 days make contact with all of the people who may have been exposed or others that the positive case identify. So we're meeting a benchmark that we're really proud of. We're able to follow up with those individuals. We know that the faster we're able to track down cases and all of their different contacts and people who've been potentially exposed, the faster we're able to get all of them tested, and the faster we're able to contain, either through isolation or quarantine, anyone that could have been exposed by our positive case. So that's kind of the broad level. But again, we could have one of our case and contact investigators talk about what they do. And this is not new to the health department. We follow up on, Amy talked about reportable conditions. So when we get, for example, a case of measles or an STD that is identified, we do this same work. So this is work we do day in and day out, whether it's COVID or some other reportable disease. And we have staff that are trained, and this is the work that they do. And many of them are public health nurses or work in our environmental health division and do this work for us. So does that help?
Yeah, thanks.
Yeah.
Thanks, Erica. Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, thanks again, Melissa and Erica, for holding these briefings. Lots of new information for us today. That's really great. I wanted to see if you could elaborate a little bit about phase 2 and what that might look, why you think it's coming up, and what you think that might look like for us.
Sure. Well, we know that the governor will make, I guess I first just want to clarify that Dr. Stern, the health department, the executive are not in a position to be able to move us into phase 2. That will come from the state. And I know that you know that, but I just want to clarify that. We know that any extension of phase 1 we'll know about that before the end of this month. And if there is an opportunity to move into phase 2, that could be as early as June. But I think from our perspective, we are really focused on making sure that we're doing everything we can, using all of the tools we have available to us, the testing, the case and contact investigations, masking, social distancing, infection control measures, the hygiene measures, that we're doing all of those things now, because all of those practices will be with us for the duration. They will be something that we are focused on for many months to come. And then and that is the basis by which we can feel more confident that if the governor does move us into phase 2, that we can be doing all of the things from the public health perspective to support that effort. And then, of course, the second piece is really helping to prepare businesses so they have buy-in, they have support, and they have the knowledge to be able to reopen in a way that they can protect their customers and their employees. So I don't have a magic ball or a date or a number, but we are aware that at some point we will be in phase 2, and we are doing everything we can to prepare for that.
Thanks, Erica. Our next question is from Joe Tehan with KGMI. Joe, go ahead.
Thanks. This is for Amy. I'm looking at the numbers on the website as far as new infections or the number of infections, and they seem pretty static generally. And we had over the last couple of weeks higher numbers, but 12 last week, a few weeks ago, 14, 13 the week before. Are you seeing things, kind of steady numbers as far as new infections?
Yeah, I mean, yes, things have been steady, but we are seeing, I think one thing that those numbers indicate to us is that there's still a continuous spread of this disease in our community, and we're still receiving cases coming in. So as Erica was mentioning, we continue to do the work we're doing, and I think what the numbers say and show us in the cases that are coming in, even though they might be lower than they were back in March, it's still persistent in our communities, and we still got to do everything possible to prevent the spread, and social distance and have our face coverings, and support each other in doing that, and supporting our businesses and opening up safely. I don't know if Erica, if you had anything you would want to add to that.
No, I guess the only thing I would add is this is as we looked at the first peak that we believe happened somewhere in late March. This is to be expected, and frankly, we're still a bit in our best case scenario, our sort of most protected state, because we've had the stay home, stay healthy order for quite a while now, for 2 months now, and so it would be unusual if we saw major spikes while that order was still in place. So this is not unexpected.
Our next question is from Key with the Herald. Key, go ahead.
Thank you. Erica, I think this is a question for you. We're still seeing questions from readers who wonder about the ability to test widely, and this would be, and I know you've addressed this, but I'm going to ask you again. They're curious, when they hear that Northwest Lab can do 10,000 tests a day, if there is a way to open up that testing to everybody, and if so, would that take an order from the health department, or yeah, what would it take if that is a consideration? Thank you.
Yeah. So we have in this community enough capacity to test broadly, and in fact, there is a healthcare coalition group that brings together lots of different healthcare providers around our community, and that is led through our deputy health officer and our health department staff, and they're meeting this week to talk about a broad testing strategy that they can all sort of agree upon and coordinate around. The issue of broad testing is challenging, and of course has nuance, as does everything with this response and this disease. But at this point, we're still advising folks to test people who have any kind of symptom. When it gets into asymptomatic, that's challenging, right? Because if you just think about outside of someone who may be asymptomatic but has a known exposure to a confirmed case, or is potentially residing in a place where there's an outbreak or a cluster, outside of that, it's really challenging, because if you're asymptomatic and you get a test, it doesn't mean that you and you're negative. It doesn't mean that you didn't actually contract it on your way home, or the next day, or 2 days later. And then there becomes a question of how often do we test our community who are asymptomatic? How regular is that? How helpful is it? And is it the right use of our resources to be testing the entire community, knowing that in order to actually see the picture, you'd have to test at a frequency that would be incredibly burdensome, and would max out our ability as a community to keep the capability where it is, and to be able to prioritize people who do have symptoms. So it's just it's not an easy dilemma that we face. We are trying to balance the need to have broader testing, because we know it works, with the need to make sure that we're prioritizing those who have come in contact with positive cases, do have symptoms, may be associated with a cluster. So it's just a continuous conversation that we are having, and trying to maintain the good capacity that we have. And I will just add that Northwest Labs does have very high capacity, but they're also able to they're also testing other communities, not just Whatcom County. They're a regional asset. So not all of that testing capacity is just for Whatcom County. So I just want to clarify that too.
Thanks, Erica. It looks like that's currently all the questions that we have in the chat feature. I'll hold for just a couple of more moments to see if there's any additional questions. All right, it looks like that's all the questions that we have for today. Thank you everyone for attending, and we will talk with you again soon.